Hi guys, today we have a great case. We're going to be doing a combination of Dysport and Restylane. The Restylane we're going to use to treat the under eyes, the tear troughs, and then I'm going to do Botox, or in Dysport in this case, to help with the frown lines, the forehead lines, as well as the lines around the eyes, what we call the crow's feet. This will give her a refreshed look. Her eyebrows and eyes will appear more open, eyebrows will be raised, and the tear trough will be corrected as well. So, just to summarize kind of what we did here today, I used 1 syringe of Restylane and a soft fill micro cannula, and I injected some filler into the tear troughs on either side, and then I put a little bit into the anterior medial cheek as well. The combination gave her some support to the under eyes, as you can see. And now what I'm going to do is I'm going to put a little bit of Dysport into the upper face to help around the eyes, open up her eyes, and help with the frown lines and forehead lines. One of the questions that I always get is, what can you do to improve the safety of under eye filler? And the tricks here are, I like to use, of course, you need to go to an injector who knows their anatomy and knows the vasculature of the face, but using a cannula helps. It reduces bruising and swelling from the injections, and I believe, in my opinion, it reduces the risk of intravascular injections. Also very important are very slow injections and very low pressure injections, and avoiding danger zones. So those are kind of the tricks here. Slow, low pressure injections using a cannula by an injector who knows the vascular anatomy of this area. That's how you get safe injections in the under eyes. So now all we're going to do is inject her Dysport. Frown for me. We're going to treat the procerus first, which is going to help with these lines, right? Horizontal lines on the bridge of the nose. Frown for me. Relax. Then I'm going to treat the medial and the lateral corrugators here, so you can see this. Frown for me. Medial head of the corrugator and the distal insertion of the tail of the corrugator on the skin. Relax for me. So we're done with our treatments. What I did was I used one syringe, one 1 ml syringe of Restylane, and I used a cannula to inject it into the tear troughs, and then a needle to inject it into the anterior medial face, of the anterior medial cheeks. Again, one syringe, just to kind of give her some support under the eyes and to improve the appearance of the under eyes. Then I used some Dysport into her glabella to help with the frown lines, the vertical frown lines, as well as what I call the horizontal frown lines at the base of the nose at the bridge of the nose caused by the procerus muscle. We treated the forehead to help with the horizontal lines on the forehead, as well as to open up her eyes and give her a brow raise. And same thing around the eyes, treated around the eyes, the orbicularis oculi, to give her a brow raise, as well as to open up the eyes. The goal of the entire treatment is a natural looking result. The goal of the treatment is also to give her a refreshed look. And I think she did great. All right.